Hello, my name is Kennedy Cunningham, and I decided to do my community nutrition reflection in the form of a video. So throughout this video, I will be drawing my experiences throughout this course and answering the questions. So the first question was, what does community nutrition mean to you? So community nutrition definitely means more to me now than it did before I took this course. I have learned a lot about community and nutrition, but to answer the question, to me, community nutrition is an effort from everyone in the community to create and improve the nutritional health within the community, to educate the community on the importance of nutrition and health, make people aware on the importance of health, and make them aware on what's accessible to them. So I pulled a quote from the course that I think ties everything together, and it is, "Alone we can do so little, together we can do so much." Helen Keller. So the second question was, what did you learn from the course? So this is very cliche but true. I learned specifically what community nutrition really is. I learned in depth what it means and everything that contributes to it. I can't say it enough, but this course was so eye-opening and made me realize how important every factor is. So I have another quote here, and it is, "A healthcare system, even the best healthcare system in the world, will be only one of the ingredients that determines whether your life will be long or short, healthy or sick, full of fulfillment or empty with despair." The Honorable Roy Rimonneau. I also learned about the social determinants of health and the circle of health, and that there is a lot more factors to health than just the healthcare system. Of course, I knew there was more to it than just the healthcare system, but I guess I just never really thought about it or what was involved in it. This course really taught me not to make assumptions. A student shared one of their personal experience about making assumptions. She was explaining how she was working at a restaurant and there were kids in the restaurant who were being super loud and playful. She was wondering why their parents weren't making them be quiet or sit down. She later found out that their house had just burned down and that they were still happy and playing. That really made me realize how much we make assumptions and we shouldn't. How many times in our lives have we said, "I'm assuming"? Probably more times than we should. And this just shows not to judge a book by its cover. I also learned about the Ottawa Charters. Even though the Ottawa Charter was made many years ago, it is still important and valid. It just goes to show that after all these years, of course, it will never be perfect, but hopefully it will continue to improve and be equitable. Some of the things I learned about the Ottawa Charters are about the three main health promotion strategies, which are enabling, mediate, and advocate. I also learned about the importance of education in all aspects. Education on healthcare, how important childhood education is, like seeing the social determinants of health, early childhood development. Early childhood experiences are what children learn from, which is important for when they become adults. I found a quote that comes from the Canadian Facts, and it is, "There are strong evidence that early childhood experience influence coping skills, resistance to health problems, and overall health and well-being for the rest of one's life." And that's found from the Federal, Provincial, Territorial Advisory Committee on Population Health, 1996. I also learned about equity versus equality, and I found this from the health lens. So, equity is important for one's overall health. When things are fair and everyone is treated right, there are happier and healthier populations. Health inequities in populations is what really showed the importance of the social determinants of health. Removing systemic barriers will have the greatest impact on advancing health equity and improving population health. I also learned about time. Everything takes time. It takes time to make changes within a system. And my last learning through this course was the importance of time and learning, and popcorning back, as Barb would say, carousels, elevator speeches, 10-minute presentations, discussion. They're all so quick, but you can learn so much. So the third question was, what do you know about community nutrition now that you didn't know before? So I now know how big of a problem child poverty is. I knew it was out there, I just wasn't aware of how large of a problem it is, especially in Nova Scotia. I also learned about the social determinants of health. Of course, I have probably briefly learned about them, but this course gave me a very good understanding. The importance of education. Doesn't matter what type of education it is, it's important. And I also now know equity versus equality. Equity, not equality. What assumptions did you have previously of community nutrition that have been challenged? The system was good and didn't have that many issues. Child poverty isn't that bad, and I didn't know about food insecurity as much as I do now. The fact that there is a lot more to health than just the healthcare system. I knew there was others, I just didn't really know about the social determinants of health. And also, lastly, how eye-opening this course was. This course had made me think in a total different way. I try my best not to make assumptions, and I have become aware of it. What were your significant learnings about community nutrition from the social determinants of health presentations, the speakers, and the class consultations with the community initiative? I didn't really know what the social determinants of health were before this class, or at least not in depth, so I learned a lot from the social determinants of health presentations. My social determinant of health was a relatively new one, so I learned a lot about gender. Between this course and my introductory sociology class, Social Problems, I have learned so many simple things that I just never knew before or was just never aware of, or seen it as a problem. I also learned about income. I guess I knew income was important and a big issue, I just never really put it into perspective. After learning about the social determinants of health, I guess I am just very grateful. This class was so eye-opening for me. It really made me realize what's happening within communities. Now I'll move on to guest speakers. So first, Demi Reamer. I learned about Kids Action and the role she plays, and she was just very eye-opening. It was so nice to hear her story. Her experience shows that what many people are going through, and she is just willing to share her story. She is truly so inspiring, and I encourage her to share her childhood and adulthood stories to many. She was a very valuable part of this course. She just brought everything into perspective and made it real, and made me so aware. Her motivation to help people and make changes for children is just amazing. She mentioned how she would never work for the government, and that just shows how caring for people she is. I also learned from Sarah. I learned about Nourish Nova Scotia. I hadn't really heard about it before, and we got to work and be part of it. This furthered my learning on Nourish Nova Scotia and on the reality of it all, and what people in the community think. It was really nice to hear back from a perspective in the community. My work group specifically got to work with the key audience, which was school-aged youth. I personally was very surprised by their responses and couldn't believe how aware they were with the prices of food and how much unhealthy food there is in their school. I also learned from the videos that we watched. 4 Feet Up. This video made me realize how grateful I should be. Isaiah, who was in 4 Feet Up, and then Donna, a different video we watched, their stories really opened a door for me on understanding what it's like to live in child poverty and food insecurity. I actually have a personal story to share. So my smile buddy actually made a comment to me that automatically made me think of this course. We were talking about eating supper, and I asked what she had the night before, and her response was McDonald's. My stepdad got the money. We aren't rich. This comment really stuck with me. I couldn't stop thinking about it for a while, really. I just wanted to give her the world and make an impact on her life. I want her to strive to stay in school, follow her dreams, and be happy. And I will do my best to do that through Smile. What skills have you developed and experienced have you had in this course that will be helpful for you working with people regardless of your career direction? To make less assumptions. I can't stress it enough. After taking this course, be the best healthcare professional I can be. If I don't become a healthcare professional, don't make assumptions about the people I work with and be grateful for my career. This course really made me want to make a difference in the nutrition community. I'm not sure how I will, but I would love to. Overall, I really enjoyed this course, and I would like to thank Barb for making it so wonderful. This course was very eye-opening, and I'm looking forward for the impacts it has had and will continue to have on my life.